Hi, let's talk a little bit about progesterone. So we talk a lot about hormones here at Thrive Chiropractic and Functional Health. And I talk about them with a lot of people because they're concerned about symptoms of hormone imbalance. So we know about estrogen. That's the one that gets all the fanfare. But progesterone is a really important hormone as well. So let's talk about what it is, what it does, and why it's important that you have the exact right amount. I always say that hormones are like Goldilocks. You want to get it just right. So what is progesterone? Well, it's a hormone. It's a female reproductive hormone. It's produced in the ovaries, specifically the corpus luteum, and most of it is produced at ovulation and in the second half of the menstrual cycle. That would be called the luteal phase of the cycle. And so what it does is it is responsible for keeping the lining of the uterus nice and fluffed up, because the idea is that when you ovulate, you'll conceive a child, and it needs a place to, this fertilized ovum needs a place to land where it can grow and develop. And so that is progesterone's role, is to keep the lining of the uterus fluffed up, if you will. So that's why it's so important in the fertility space. So it also opposes estrogen. Think of progesterone almost like the brake pedal of estrogen, because we have estrogen that builds up the lining of the uterus, and progesterone that keeps it built up. But if we don't oppose estrogen, we get too much buildup of the lining, and we don't have an opposition to it. So these two hormones, they function like a teeter-totter. And it's really important that when you're looking at hormones, that you're looking at them in balance with one another. So many people come in to see me and they've got a list of hormonal symptoms, and they're wondering why they feel the way they do when they've been told, hey, all your hormone levels look within range or normal, or whatever the verbiage is there. But what is not being done is looking at where they are relative to each other, like a ratio. And if you've got estrogen way on the upper end of normal and progesterone on the very low end of normal, then you really feel out of balance, even though on paper it may not look that way. So that's the art of balancing hormones and knowing that. So that's one thing that we definitely see is making sure these two are in balance. Some of the things that that people will tell me when their progesterone is low, and usually the problem with progesterone is that it's too low. It's either grossly too low, meaning you do a test and it shows up low, or it's low relative to estrogen. So some of the symptoms that a person that is experiencing lower than ideal levels of progesterone, or an imbalance in progesterone to estrogen ratios, would be irregular menstrual cycles. And usually this shows up as a lower progesterone level will shorten the cycle. So someone who has always been pretty regular at, say, 27, 28, 29, 30 days long their cycle, and then all of a sudden it gets a little shorter and a little shorter. So now they're down to 27, 26, 25, and this happens, I see this happen more to those people who are over 35. As we're landing the plane to menopause, which happens around about age 51 in the US, that's the average age of menopause for a woman, progesterone will fall down faster than estrogen. So what you have is you have estrogen and progesterone both declining, but progesterone doing it faster, so you have a bigger relative gap. And so what we see is a lot of women will tell me, hey, yeah, my cycle is getting a little bit shorter. So it used to be every 28 days, and now it's 26 or something like that. So, but because it can affect how estrogen behaves, you could see things like heavier bleeding, or just a cycle that is off in some way. It's heavier than it should be, it's shorter than it should be, it's just not what it normally is. How about PMS? That's a big one. You've got cramping, you've got breast tenderness, headaches, you've got moodiness, irritability, all those kinds of terrible things. Infertility or trouble conceiving. Because progesterone is what's responsible for keeping that lining of the uterus hospitable to a newly implanted ovum, if you don't have enough progesterone, you can actually miscarry because you just don't have enough progesterone to make that a good place for that to implant. Another thing progesterone does is it keeps you from having premature contractions and losing your baby that way. So that's, in the over 35 space, if you are looking at fertility issues, always look at progesterone. And if that's you and you're struggling with that, I just want to say that I am sorry. I myself had 2 miscarriages in my mid 30s, and I had my 2 babies at 36 and 39. So I was a little bit older when I did that, and I had to use progesterone both times with that because of the miscarriage history. And so anyway, just know that you're not alone, and that my heart goes out to you, because that's a hard thing to deal with. And then we're talking about mood changes. So you can have things like irritability and moodiness and things like that, because progesterone not only affects, it's not only a female reproductive hormone, it affects neurotransmitters in your brain, it affects cardiovascular health and things like that. So a whole bunch of other things there. Fatigue. Low progesterone levels can make you feel really tired or have low energy. Sleep disturbances. So sometimes it's hard to fall asleep, sometimes it's hard to stay asleep. Now, of course, those can be problems with your adrenal glands, problems with your blood sugar handling, stress, all kinds of things. So, but a hormonal imbalance there can play into that as well. Changes in your libido, and specifically a decrease in your libido. Vaginal dryness. Estrogen can be a player in this too, but so can low levels of progesterone. And weight changes. Hormonal imbalances, including low levels of progesterone, can also affect your ability to lose weight. And that's especially true when you talk about the ratio between estrogen and progesterone. That being off can make it difficult to lose weight. There's a hormonal component to that for sure, and I see that a lot. So that's kind of the symptomatology of what someone looks like when they are experiencing low levels of progesterone. So then we look at, okay, first of all, how do we know whether our levels are low? We test for them. I test. There's 3 ways to test hormone levels. You can do it in the blood, the saliva, or the urine, and they all have different pros and cons. And the first thing I do when I'm working with somebody and trying to help is I listen to them, and I try to find out exactly what their issues are. Then we can match them with the best kind of test. Blood has some advantages and disadvantages. Same thing with saliva and urine. So that's where it's really important to figure out what are your problems, what are you trying to figure out, and then you match the best test with that. So I do something called a discovery call, so you can check that out, and there's a link for that to book a discovery call, where you can, I'll give you a free phone call, and we'll just talk through it, and I'll listen to you, and if I think I can help, I will help you unpack what that looks like, what kind of testing we need, and how we're going to do that. So then you can come along and you can find out, hey, are my progesterone levels low? Am I just low compared to estrogen? Or what does that look like? And then you can create a plan that will get you feeling good again, back to your normal self. Okay, thanks for watching.